I like to look at things both not only subjective but objective improvement. Whether it's prescribing a certain eye vitamin that has like lutein, zeaxanthin, or something like along those lines, I like to look at things objectively as well as subjectively. And so it really reassures the patient that we're in the best interest of their symptoms and their longevity of their eye health. And so I think that something that resonated with me when answering your question was that, we've been able to get people back into contact lenses. That one of our first patients, that she couldn't wear contacts for 6, 7 years. She had her daughter's wedding coming up, and she just had such bad contact lens intolerance. Her eyes were bright red, and she's using Visine to get the red out. But the more you use that, the worse your eyes get. In terms of, well, after we did the treatment, and it kind of really changed, and she's still in contacts to this day. It really kind of changed my looking at how effective this was. But whenever I purchase something for the office, for patient care, we look at all the clinical data in terms of the validity and the repeatability. Some physicians in different fields, they'll sell you this pen and just to sell something, and that's not our intention. Our intention is to use something, invest in something in the practice that gives better outcomes and improve quality. And I always like it as we call our patients our extended family of patients, because we really take care of people like family, and at least the family members we like to talk to. And everyone's got those that don't. What makes me feel really good inside is the fact that, unfortunately, a lot of practitioners aren't as forthcoming, or aren't as progressive, aren't as on top of things. They get stuck into making the same widget every single day, not trying to spend the extra time of new technology, introducing new things. And, we're in Chicago, and people come from Northwestern and UIC and Rush. And I feel so bad for a lot of these patients, because they think that their dry eye is being addressed, and they'll come into our office and they've been referred by somebody or find us online. And they'll say, "What are those?" I'm like, "What do you mean, what are those?" "Those are your meibomian glands. That's 86% of the cause of dry eye." And they've been to all these different ophthalmologists and specialists, and they don't even see what their glands look like. And to me, that's really kind of sickening and upsetting, the fact that you can't really address dry eye if 86% of the root cause is the meibomian glands. How do you not image those? And the way the healthcare system has been, when I referred a patient last week to a physician to get a physical, because we found diabetes in a 38-year-old, and I said, "You got to get in your doctor." He goes, "I can't get into for a physical for 4 months." I'm like, "Well, at least you get blood work taken." So the hospital systems are so just overmanaged, and you're trying to crank through patients. Unfortunately, the quality of care has gone down significantly. And dry eye is something that by ophthalmologists is very times marginalized, in that they don't want to spend the time, or don't have the time to spend with patients discussing all different options, the treatment protocols. In these hospital systems, their production, which is unfortunately one of the main factors for longevity as an employed ophthalmologist with these hospitals, is their surgical production and all those types of medical billing. And so if they're going to spend 20 minutes, 25 minutes with a patient describing dry eye and different treatments and things like that, from a monetary perspective, they probably get more, financial incentive by scheduling more cataract surgeries for that in that hour. So that's the way it is. So personally, for me, I've always been a people pleaser since I was 5 years old, and always want to do good by the patient. It makes me feel good when patients feel good and tell others about us. So.